Hi, welcome to We Smile. My name is Dr. Nadia Al-Aasm. The owner of Cabana Dental, and today we have a guest with us, Dr. Maxwell Abraham from Abraham Orthodontics.
Awesome.
How are you?
Good. How are you?
Good. Thanks
Good.
for coming on the
Well,
show.
thanks for having me. It's an honor. So a little bit about myself. I'm born and raised in Leamington.
Awesome.
I went to Western University for my undergrad and dental training, and then Marquette University in Milwaukee for my specialty training in orthodontics. And about 2 years ago, we opened up our practice, Abraham Orthodontics in Leamington.
Awesome.
And, we've opened the office to really strive to move beyond traditional orthodontics, and doing exceptional, efficient, and kind of more importantly, affordable care
Yeah.
for everybody from 7 to 77 years old with solutions for everyone.
That's great.
Yeah,
That's
and I have to
great.
say congratulations to you too on your
Thank
new practice.
you.
It looks
Thank you.
fantastic.
Thank
Seen a
you.
lot of
Appreciate it.
photos, and it looks great. Wish you all the best.
Thank you. I have a few questions, and actually, we've had a lot of questions submitted to WePodcast and also on Facebook and Instagram.
Yeah.
So I'm going to ask a few of the questions that were submitted from some of our viewers, and then also I have a few questions of my own. Okay,
Perfect.
so first question: what age should the child see the orthodontist?
Over the past year and a half, we've really strived to educate our referring dentists, as well as dental hygienists and assistants across Windsor, Essex, and Chatham, that the perfect age is 7 years old. And
Okay.
really, the important thing to remember is that at 7, most of the kids aren't going to need any treatment.
Right.
But there's that narrow window of time where there are certain things that we have to treat before 9 or 10 years old, where some of those problems with the jaws or with the teeth can't be corrected until later on.
Yeah.
So we want to make sure that at least for those patients, we're seeing them, we're identifying those problems, and we're treating it when
Yeah.
we're supposed to.
Makes sense. Makes sense. What are some of those early major signs that parents should look for?
The main one that we really try to educate our parents with is an underbite.
Okay.
So that's essentially when the lower jaw sits ahead of the top jaw.
Right.
And the problem with that is after around 9 or 10 years old, that upper jaw really cannot be influenced to grow anymore.
Okay.
So
yeah.
all the things that we'd want to do to
Mhm.
it really won't work. And if we miss that window of opportunity to treat it, then those same patients are for sure going to need some type of jaw surgery once they're done growing later on in order to correct their bite.
Right.
And, another skeletal problem is kind of the same thing, but more from left to right. So kind of when the lower jaw or the chin is deviated or off to one side, which is
Okay.
just called a crossbite.
Crossbite. Yeah.
And it's the same thing with that. If we don't treat it before 9, 10, 11 years old, we find that actually one side of the jaw will grow larger than the other. And again, it's something that can only be corrected with surgery later on.
Right.
And the interesting part with that is, even though we can correct where the actual jaw is, sometimes the soft tissue like the nose, the lips, the chin, they never really look normal as they're supposed to.
Right.
So simple preventative procedures that we
Yeah.
can
Getting
do
it,
at
the
7
growth.
or 8,
Exactly. Yeah.
can really prevent a lot of more complex problems later.
Okay. Awesome.
And, mainly from a dental standpoint, we get this a lot from new moms. The big thing is making sure the left and right side of the mouth match each other.
Right.
So if one side on the left is coming in, one tooth, the other tooth on the other side should also be coming in at the same
Yeah.
time. And then the obvious ones like major spacing or major crowding where teeth are overlapping each other.
Right.
Those are really reasons for someone to, pick up the phone, call their orthodontist, make an appointment, and
Yeah.
have it checked out.
Well, that's awesome. I do want to ask you, so how do you determine if they should have treatment now or when they should wait for the appropriate growth?
With those issues that we talked about before, those are things that are going to be done ASAP.
Okay.
Okay, and when we do them, it's done as a phase 1, where we're really only correcting that specific problem.
Right.
So we're not doing Hollywood smiles at 7 years old.
Right.
It's really
Yeah.
just that specific skeletal problem. And the majority of those kids will actually need a second phase or part 2 of treatment to correct everything else about their teeth later on.
Okay.
Now, there's a lot of other issues where, the scientific research and the highest levels of evidence shows that it really doesn't make a difference if we treat it early or later. And it's our practice philosophy at Abraham Orthodontics that we wait to treat those. We'll want to treat them all a little bit later on,
Right.
closer to when all the permanent teeth come in. So for those kids that really don't need anything just yet or don't need that phase one, we have a great Growing Smiles program where
Okay.
we see the kids every 6 months to a year.
Okay.
We check on their teeth, check on their growth to really see how things are developing.
Yeah.
And making sure that we don't miss any opportune time to treat anything,
Okay,
to treat
yeah.
any issues that come up. And we do that service at no charge for families.
Yeah.
So they come in yearly, and it creates a really nice dynamic with our family dentists so that, they know that when it comes to
Yeah.
the growth and development of the children, that someone's looking after it. And, making sure that if any issues come up, we're right there to see them.
Yeah. That's great. That's great. How early can a child wear braces?
Again, it really depends. For somebody to have braces as a phase one, so again, we're looking at around 7, 8 years old.
Yeah.
It's usually braces on the front 4 teeth. And there are specific issues where that may need to be done, mostly to rearrange the teeth if they're coming in funny positions. But I think most of the time when kids have, braces at that young of
Right.
an age, it's more of an elective thing. So it's something that we know that we can correct it later on.
Okay.
But sometimes the parents choose to correct it now, and the two main reasons could be one is just from bullying or more from a self-esteem aspect for their
Right.
child if they're affected by it.
Yeah.
And the second reason would be if they're really prone to trauma. So the one thing is if they have a really large overbite and the
Right.
teeth stick out and there's some, concerns that there's going to be some accidents on those teeth, that might be something where we would do it early.
Okay.
But for the most part, like we said before, it's really important for us to educate our parents and tell them that whether we do it now or later for the majority of things, there's really not going to be a difference.
Okay.
So we want to be as efficient as possible in order to do everything all at once in a short 2-year span
Right.
when they're of age.
I'm sure a lot of parents ask you if it's more expensive to do it now or do phase one now and phase two later.
Traditionally and technically, yes,
Okay.
it is more expensive. Again, our office philosophy is a little bit different.
Okay.
So for us, what we do is we essentially take our regular full treatment fee, and if a phase one is needed, we just apply a portion of that full fee now and the rest of it
Okay.
later on.
That's great.
Normally what's done is that there's the full fee later on and then another fee for
Right.
phase one, which
Yeah.
can become costly for parents at the end of the day. So, and we really do this because we really want to ensure that when we are doing something for a phase one, we know that we have to do it.
Right.
We know that it's going to be in the benefit of the
In the best
patient and the
interest.
family
Exactly.
in order to do it for them so that we're not wasting anyone's time or, more importantly, their money.
Okay. Awesome. Awesome. So I actually have this in my family. My daughter used to suck her thumb, so this is a question I get a lot from parents as well. But what do you suggest for children who suck their thumb, and how do you break the habit?
With sucking the thumb or finger or any type of oral habit
Yeah.
like that, the sooner the better.
Okay.
But really for us, the time to lay down the law to intervene is really when those front top teeth start to come in.
Right.
And realistically, if the thumb or finger is always in the mouth, those top teeth are never going to come down on their own. They're just
Right.
going to stay where they are. So sometimes just a simple conversation with the child or reminder therapy. So,
Mhm.
the Band-Aid on the thumb. What I find it works best at home is positive reinforcement. So
Yeah.
we'll give patients a calendar and they track every day that they
Yeah.
suck their thumb or don't suck their thumb. And then we'll just ask the parents to reward them. If they go, a week or 2 weeks
Mhm.
without doing anything, give them a treat, do something, surprise them. Now, when we've exhausted all those, I guess, at-home options, the last resort is really putting something physically in the mouth to
Okay.
stop the thumb from
Right.
going inside. And the only time we ever do that is if, one, the child's old enough to realize that they
Right.
have the habit.
Yes.
They know that whatever we're doing is not punishment and we're there to help them. And the most important is that they actually want to stop.
Yeah.
You know, there's a lot of children, even up through 7, 8, 9 years old, where they're not ready yet.
Yeah.
And
Yeah.
sometimes it's better to give them the time to get there than to force something on them.
What age do you normally, what would be the youngest you would put that in?
Generally, when the front teeth erupt, we would say around between 7,
7.
8 years old.
Okay. Another thing I found that helped for me to get my daughter to stop is actually removing the objects. So sometimes they'll kind of tie it into like a trigger, like a blanket or a toy. For her, it was like a little bunny that was like a blanket, like a binky, and we had to remove it.
Yeah.
Because she associated that with her thumb. So once we removed that, and that was probably the hardest thing I had to do, we removed it for about 2-3 weeks until I knew she stopped, and then we had to give it back to her. But that really helped. So if there is like a trigger or like a blanket or toy that you notice your child doing it with, then that would be something as well. I'm sure you educate your parents
Yeah.
on that as well.
And
Yeah.
what makes it easier when you remove that from them
Right.
is kind of substitute that with yourself.
Yeah.
You know, so if they're having trouble falling asleep without their blanket that you took away, hold their hand until they fall asleep, read
Yeah.
a story. It can be time consuming, but
Yeah.
you know, it doesn't take very long for the habit to break.
Right, exactly. Okay, so another thing, I did look at your website, and it was very nice. And you did have there the differences between braces, clear aligners, Invisalign. Can you tell me a little bit more about that?
Yeah, so everybody knows what metal braces are. Clear braces are commonly mistaken for many different things.
Right.
You know, generally clear braces are the same as metal braces, but they're
Okay.
just made out of porcelain, so they're tooth colored.
Okay.
And they work the same way braces do.
Yeah.
Invisalign, or clear aligners, is a little bit different. It's totally different. It's
Yeah.
actually, it's clear plastic trays that fit over the teeth.
Okay.
And every week to 2 weeks, they're changed. As you change through the trays, through 20, 30, 40, 50 of them, your teeth are slowly moving with every single new set. And it's an amazing process where, you know, the orthodontist will, you know, take an impression, we'll get a digital copy of the
Right.
teeth, and we're moving the teeth on a computer to their perfect position relative to, you know, your face, your jaws, you know, relative for the right age,
Right.
just to make everything to the ideal. And then we break down that movement from start to finish into these tiny little steps. And those tiny little steps are the trays that you
Yeah.
wear.
Yeah.
So the clear trays are clear. They just fit over your teeth. You have to take them in and out yourself. They have to be in 22 out of 24 hours.
Yes.
So essentially they're only out if you're eating or brushing your teeth.
Yes. Yeah.
And, you know, we find a lot of patients like it
Yeah.
because they really can do everything that they've always done with their teeth. They can eat the food that they want. They can brush and floss as they please.
Right.
You know, a lot of the tedious aspects of having braces kind of get
Right.
removed
Yes.
with it.
Yes, we do Invisalign as well. But I noticed that it is an advantage, especially with those patients when it comes to eating, or they don't have to avoid certain foods, or you know, they can kind of, like you said, go about their day and no one really notices. So if you're
Exactly.
kind of like in a corporate industry business where you can't have braces, I mean, it's
The best are brides to be.
Yeah.
Because it's really important for them where, you know, by the time they do their wedding photos or engagement
Yeah.
photos, they really can just take out their aligners, do their photos, put it back in. It's like nothing happened.
Yeah, yeah, awesome. I do have a question here that was posed on Facebook. Basically, I want to ask about how you go about doing braces for someone who has TMD problems, if you can explain that a little bit. TMD, temporomandibular disorders, which refers to pain in the jaw. So are patients with TMD disorders, are they able to get braces?
It really depends on what the cause is. So
Okay.
as you said, TMD just categorizes a vast array of issues with the jaws. So it could be from the nerves, it could be
Right.
from the muscles, it could be from, you know, the physical joint, like similar to arthritis.
Right.
So the first thing for us is to identify what it is, and from there, how long it's been like that, the severity of it, and how much of that discomfort is really affecting their life.
Right.
And depending on what's there, sometimes we will want to address it. And it could just be sometimes simple at home exercises. It could be referring them to a physiotherapist,
Okay.
or for more severe cases, seeing a pain specialist or an oral surgeon before we even start treatment.
Okay.
So depending on what the problem is, if we feel comfortable enough that the situation is stable
Yes.
and it's healthy, then we usually are okay to just continue on. But honestly, with anything in the mouth, whether it's, cavities or needing a cleaning
Right.
or the health of the gums or anything like that, before we start any orthodontic treatment, it's really important for us to make sure that everything else is healthy.
Exactly. Yeah.
Moving teeth, as you know, can really exasperate tiny problems that are there and make them a lot more severe and a lot
Yes.
more
Yeah.
complex.
Yeah.
So a lot of patients, many people don't know this, but they don't need a referral to see an orthodontist.
Okay.
So, for example, they can call our office and book an exam
Yeah.
on their own, but we'll still, on our end, make sure that they are current and up to date with their family dentist
Okay,
and make
yeah.
sure that everything's healthy, everything's there before they even start.
Yeah. Awesome. Okay. All right. So I'm sure, parents and patients, they worry about all this technology and they talk from like the soccer fields and the hockey rings and they want to know, is it expensive?
Really, nowadays, orthodontics is as affordable as it's ever been.
Okay.
And, a lot of patients and families, they usually have coverage through their insurance plans to cover half or less
Yeah.
than half of cost for each of their child. And at our office, it's really important for us that although we're making these amazing, confident, beautiful smiles, either for people's children or for themselves, we never want it to be a burden on the family. So for us, in addition to having the free exams, to get all the information that you need, the proper information, we also offered monthly payment plans on
Okay.
that full treatment fee. There's no interest. The parents and families really, dictate what's comfortable for them per month. And really, that's what it is. And, it goes back to our office philosophy that we really want to make orthodontics accessible to everybody.
Yeah.
For those that want it, but I think more importantly for those that need it.
Yeah. Okay. Do you offer, is this like a third party payment plans that you?
We do all these in office, actually.
Oh,
We're
okay.
not a bank. We're
Yeah.
not trying to do anything of it. We really just want this to be a convenience for the families. We know realistically that orthodontics and braces aren't always at the top of the expense list
Yeah.
for them in terms of priority. So we do our best to help make it comfortable, make it seamless as possible, so that they or their children can get the confident, beautiful smiles that they want or need for life.
Okay. Awesome.
Great.
Thanks. All right. Speaking about Invisalign, what type of cases can you do with it? Are you doing more complex cases with it?
Generally, the types of patients that can be seen for Invisalign will vary between office and office
Okay.
and between orthodontists or dentists, depending on how they feel it works best in their hands. We're proud that our practice, Abraham Orthodontics, is ranked second in all of Windsor, Essex, Chatham,
Awesome.
and even into London in terms of experience
Yeah.
with it.
Congrats.
So we see quite a bit, and it's not uncommon for patients to come to see us for, another opinion about it. And generally, we are really treating things almost apples to apples with braces compared to Invisalign. There's
Awesome.
still some minor things where, braces might be more beneficial.
Yeah.
But for example, right now, we're even doing some surgical cases with Invisalign.
Awesome. That's awesome. Great. All right. And how do you book an appointment?
So there's really two ways. So one, patients can ask for a referral from their family dentist at their next visit, and that's
Okay.
traditionally most commonly done. Alternatively, as we've said, we don't need a referral to see an orthodontist. So they can contact us directly, either on our social media pages, which we're very active on,
Yeah.
or even just simply calling the office to schedule an appointment. We offer free exams where on that first visit, we're looking at everything and we're
Okay.
giving all the information that the family needs in order to make a decision if treatment is needed or
Okay.
if they want it.
Okay. If someone needs a filling or a cleaning, can they start treatment right away?
Definitely not.
Okay.
It's really important that the whole foundation of the teeth are healthy before we start. So even if patients do seek us out on their own and we do our exam, we still go on the back end and check with their family dentist to make sure
Yeah.
that everything's up to date.
Yeah.
And if it's not, we really need to make sure that everything is taken care of before we actively start treatment. And the reason for that is, even some things like a very small filling or something that really might be able to hold off for some time, moving those teeth around that are slightly infected
Yeah.
can really trigger a huge response that can put, the patient and their teeth in a worse position than when they
Right.
started.
Yeah. So essentially you want to start with a good foundation. And how often do you recommend cleanings more often with the orthodontics? Or
Well, that's the important part. So, a specialist, even though we were dentists first, we don't replace the family dentist. So,
Right.
while they're in treatment, all of our patients need to see their family dentist every 6 to 9 months for their cleanings
Yep.
and checkups. And, I think that's a very important part for treatment to be on time, and as smooth as possible.
Okay. Okay. Awesome. And how long do you wear retainers for?
We get this one a lot, and there's been so much research into this to really avoid people having to wear retainers for a long time. And at the end of the day, it all comes down to the same thing. You need your retainer for life.
Okay.
So when you first get your braces off or when you first finish your treatment with your clear aligners, the retainer should be worn full time.
Right.
And possibly after about a year, you can start to wear it less and less. So maybe just at night, or you could wear it every other night. And the important part is, as long as you want your teeth to stay straight, you wear that retainer in some shape or form. And the biggest trick is really when you wear your retainer, if you feel that it's really tight, tighter than it was the day you got it
Yeah.
the very first time, that means you're not wearing it enough.
Yeah.
So wear it more often. And that's a really good way that, we educate our patients to really self-evaluate where things are at with their
Right.
teeth.
Okay. Awesome. Well, thanks for coming on the show. I think you answered a lot of questions that some people may have been thinking of, or a lot of questions from our viewers as well. And if anyone has any other further questions, you can either email WePodcast, or you can email us at info@cabanadental.ca, or you can email Dr. Maxwell Abraham as well.
And
They're
that's-
pretty active on Facebook too.
Yeah, and our email's the same, so it's info@abrahamorthodontics.com.
Okay. Okay, awesome. Well, thank you for
Awesome.
coming on the
Thanks
show.
for having
Thank
me.
you.
I really appreciate it.
Thank you. All right. Thank you.